human metapneumovirus (HMPV) most commonly causes upper and lower respiratory tract infections in young children, but is also a concern for elderly subjects and immune compromises patients. Hello friends, welcome back to the channel. Like, share, subscribe and don't forget to press the bell icon. HMPV is the major etiological agent responsible for about 5% to 10% of hospitalizations of children suffering from acute respiratory tract infections. HMPV infection can cause severe bronchitis and pneumonia in children, and its symptoms are indistinguishable from those caused by human respiratory syncytial virus. Initial infection with HMPV usually occurs during early childhood, but reinfections are common throughout life due to the slow growth of the virus in cell culture. Molecular method such as reverse transcriptase, that is PCR, RT-PCR, are the preferred diagnostic modality for detecting HMPV. A few vaccine candidates have been shown to be effective in preventing clinical disease, but none are yet commercially available. The understanding of HMPV has undergone major changes in recent years, and the current ability on the molecular biology and epidemiology of HMPV. The current therapeutic interventions and strategies being used to control HMPV infections, with an emphasis on possible approaches that could be used to develop and effective vaccines against HMPV. Acute respiratory tract infection is the leading cause of morbidity and mortality worldwide. Globally, acute respiratory tract infections were responsible for about 20% of total death in children less than 5 years of age in 2000 alone. Moreover, about 70% of these deaths occurred in Africa and the southern regions of Asia. Acute respiratory tract infection affects children regardless of their economic status, with similar incidence rates in both developed and developing countries, but with a higher mortality rate in developing countries. The risk of pneumonia is higher in children in developing countries, that is 10 to 20% compared to 3 to 4% in developed countries. A wide range of etiological agents are responsible for respiratory problems in children. Although upper respiratory tract infections are generally less serious, they nonetheless carry significant societal cost in terms of lost work, lost school days, and additional healthcare cost. For this reason, determining the etiological agent of this infection is more important. With decades of and epidemiological studies that has been able to establish the importance of known viral pathogens like human respiratory syncytial virus HRSV, parent influenza virus, coronavirus, and rhinovirus. However, despite these, a substantial proportion of respiratory tract infection still cannot be attributed to any known pathogens. Human metapneumovirus, that is HMPV, was first in the Netherlands when the virus was isolated from a pediatric patient who had symptoms similar to those of HRSV. Human respiratory syncytial virus infections. Since then, HMPV has been detected in 4 to 16% of patients with acute respiratory tract infections. The incidence of HMPV may vary from year to year in the same area. HMPV causes disease primarily in children but can infect adults and immunocompromised individuals as well. The clinical features of the illness caused by HMPV infections range from a mild upper respiratory tract infection to life threatening severe bronchitis and pneumonia. Belonging to the order Mononigavirales, the Paramyxoviridae family is divided into the subfamilies Paramyxoviridae and Pneumonoviridae. The Pneumonoviridae subfamily is further divided into two genera, that is pneumonovirus and metapneumovirus. HRSV is placed under the genus pneumonovirus, while HMPV is placed under the genus metapneumovirus. Whole genome analysis that HMPV exists as two genotypes A and B based upon the sequence variability of the attachment G and fusion F surface glycoproteins. These two genotypes are further divided into subgroups A1, A2, B1 and B2. Subgroups A2 is again divided into A2A and A2B. A strain that is under major subgroup A but does not fall into subgroups A1 or A2, and hence there may be a new subgroup evolving in the A major subgroups. The molecular biology of Hmpv advanced significantly with the establishment of reverse genetics platforms, but still lack a reliable vaccine to control Hmpv infections. Findings in Hmpv molecular virology, diagnostics, and control strategies.